In the world of modern medicine, few antibiotics carry as much power, and as much risk, as fluoroquinolones. A class of broad-spectrum antibiotics, fluoroquinolones are the last line of defense against some of the toughest bacterial infections. They work by disrupting the very blueprint of bacterial life, the DNA replication, crippling infections from within. Fluoroquinolones work by inhibiting bacterial DNA gyrase and topoisomerase 4, enzymes essential for bacterial DNA replication. Common fluoroquinolones include ciprofloxacin, used for urinary tract infections, UTIs, respiratory infections, and anthrax exposure. Levofloxacin, treats pneumonia, sinusitis, UTIs, and skin infections. Moxifloxacin, often used for respiratory infections, including pneumonia and bronchitis. Ofloxacin, used for UTIs, sexually transmitted infections, and certain eye and ear infections. Norfloxacin, primarily for UTIs and prostatitis. Generally, fluoroquinolones are effective against gram-negative bacteria, but the newer ones are wide-spectrum and have shown effective against gram-positive species also. But with great power comes great risk. Fluoroquinolones can cause adverse effects that range from mild to severe. Common adverse effects include nausea, diarrhea, headache, and dizziness. Serious, but rare, side effects are tendon rupture, peripheral neuropathy, QT prolongation, CNS effects, and aortic aneurysm risk. Fluoroquinolones should be avoided in pregnancy and children where they increase risk of cartilage damage. Secondly, they should not be taken with antacids, dairy, or supplements containing calcium, magnesium, or iron since they reduce its absorption. Due to the risks, fluoroquinolones are generally reserved for serious infections when other antibiotics are not suitable. Now, we will make a fun mnemonic that will help us retain all these crazy pharmacology facts. Since all fluoroquinolones have the word floxacin in their names, we will picture a flock of pigeons to represent these drugs. First, we see an old pigeon sipping a drink. That's ciprofloxacin, one of the oldest in the class. Next, a pigeon is leaving the flock. This one represents levofloxacin. A wandering pigeon moves around. This is moxifloxacin. And finally, a muscular pigeon, flexing like a gem. That's gemifloxacin. Scattered between them are pink bacteria, showing that fluoroquinolones are effective against various gram-negative bacteria. Nearby, we spot discarded tubes, symbolizing their activity against tuberculosis. Some young pigeons surround purple bacteria, reminding us that levofloxacin, moxifloxacin, and gemifloxacin have enhanced gram-positive activity. And look, our old pigeon is admiring a Mona Lisa painting, a clue that ciprofloxacin is especially effective against Pseudomonas. Now, let's see the important side effects of this class of medication. Let's have a jogger kneeling down, clutching a torn Achilles tendon, a warning of tendinitis and tendon rupture. A child cries while holding their nose, hinting at cartilage damage in growing children. A squirrel with a long tail scurries by, symbolizing a prolonged QT interval, a serious heart risk. And finally, a pregnant mother watches from a distance, because fluoroquinolones are contraindicated during pregnancy.